Presented locally by IT&E. KUAM News Headlines is presented by Calvo's Insurance, a legacy of trust, serving Micronesia since 1938. Matson and the Adahi Tano program. Cars Plus, home of Guam's first and only lifetime limited powertrain warranty. IP&E, fueling excellence. McDonald's of Guam, I'm loving it. And King's Restaurants, always open, always local, and serving up favorites for over 40 years.
Now on primetime, medical staff and employees at Guam's only public hospital being monitored for exposure to coronavirus. Plus, the skilled nursing unit has officially opened to take COVID-19 patients. And the local shipping industry reassures the community there's no need for panic purchasing.
Half a day, everyone. I'm Adriana Cotero. At noon today, the governor's directive for mandatory social isolation went into effect. Several businesses are now closed. You can still get groceries, gas your car, and order takeout. But for the most part, you should stay home and off the streets as a precaution against exposure. As of the latest update from the Joint Information Center, which was issued last night, there are now a total of 12 confirmed positive cases of COVID-19 on Guam. 4 were confirmed Thursday. Only one of them had travel history while the rest did not. Additionally, the GIC confirmed that 3 cases that turned up positive on Wednesday also had no travel history. A total of 81 tests have been performed at least through Thursday. We are still waiting for the latest numbers from the Joint Information Center from testing conducted today. Make sure to download the KUAM mobile news app to get the latest information. Medical staff at the Guam Memorial Hospital are being monitored for symptoms of the coronavirus. This after a patient who wasn't showing signs later turned up positive. Sabrina Salas-Montanani reports.
I'm gonna tell you.
Video and audio circulating on social media.
But GMH broke protocol. And apparently the entire place is infected.
Prompting a response from the Guam Memorial Hospital to clear up the COVID confusion.
That doesn't help us.
GMH Administrator Lillian Posadas on I-94FM's Containing COVID-19 radio show saying it was last week a patient came into the emergency room. He did not have flu-like symptoms but admitted as a result of other complaints.
So based on that information, we did not put him in an isolation room because there was no orders by the doctor to put him in an isolation room. We did, however, put him in a private room. So that kind of helps us at least contain it.
The private room was in the hospital's medical surgical inpatient adult unit located on the 3rd floor. It was only when a radiological procedure was completed a few days later that the physician determined the individual may have the COVID-19 infection. The patient ultimately tested positive, and Posadas notifying all employees and medical staff members that some may have been exposed.
There was minimal exposure to the public because the individual was in a private room with a closed door. What the high-risk exposure was, staff who had no knowledge that this individual needed to be in isolation had, up close and close interaction with the direct and close interaction with the patient. And so those were the ones who were at high risk. It's the staff.
Posadas shoots down claims that newborns were exposed.
The individual that we admitted into the private room was on 3rd floor. He did not wander into the 2nd floor to the newborn area. So again, very, very minimal exposure to the newborn. And even if you are walking through the hallway of 3rd floor where that patient was, walking the hallway, you are low risk.
Currently, all staff who had direct and close contact with the COVID-positive patient are being contacted with the possibility some might be quarantined.
Yes, our employee health nurse and our infection control nurse is working with them and processing them accordingly, and they are being monitored. And yes, if they start manifesting the symptoms, definitely they will be swabbed and they will be tested. That's part of the protocol for CDC, okay? If you are exposed, definitely you will be quarantined. But if you're not manifesting any symptoms, you can still come to work and wear a mask. Even if and if you're quarantined at home, you stay at home. But if you're manifesting symptoms, especially, if you're not manifesting symptoms, and although, you had that exposure, wear masks. And we're making all the employees wear masks. Even our admin staff, we're all wearing masks here because we don't know who we could be encountering and could be a COVID-positive person.
Posadas, in the meantime, thanks all the employees and medical staff members for their bravery, unquestionable commitment, and commendable courage, especially in this epic biological battle. Reporting for Guam's News Network, I'm Sabrina Salas Matinani.
Sinahanya Mayor Robert Hoffman shares how a trace investigation into a COVID-19 positive patient led to a birthday party in his village. Chris Barnett has more.
Mayor Robert Hoffman of Sinanya tells KUAM early this week he got a call from Public Health, the department investigating one of the first COVID-19 positive patients on Guam. The mayor telling us what Public Health told him.
Mayor, we're doing our tracing and our backtracking, and the person of interest, a person under investigation, probably went to your center. We're just double checking, and we wanted to see your, attendance records.
Mayor Hoffman said DPHSS then got contact information for everyone who attended a birthday party at the Sinanya Center, going down the line, contacting those people to see if they had any close contact with the positive patient. The mayor saying when word got out that a person who later tested positive for COVID-19 attended that party, families of an uncle who attended as well were worried.
Their families naturally are concerned. We are concerned. Like I said, my parents go there. And so I'm checking my mom and dad. I'm like, Mom, how's your temperature, Dad? Is everything okay? They're like, we feel fine, boy. We want to go bingo. I'm like, I said, stay home.
If you have the COVID-19 virus, even if you don't have symptoms, you can still pass it on to other people. Because of this, Hoffman said he kept in close contact with Public Health.
Did you find anything happened? We said, they're like, no. And we've been in contact with our seniors because of the NEAL program, and everyone that we talk to is at home. And they're there, so, praise the Lord. We don't think that any of our seniors got caught.
Meanwhile, the mayor says his colleagues and their respective constituents on the Mayor's Council of Guam have been demanding to know if there are any COVID-19 positive patients in their villages.
You told us where the dengue was. That's the only way we were able to respond to it quick enough to kind of get these areas. So we don't understand why it's different for this specific. I think people want to know to either one, avoid it, and two is that it can take the corrective action. They keep citing different rules and laws, but we keep coming back to them about the dengue and all the other stuff.
Meanwhile, Orda-Chalampogo Mayor Jesse Gogui tells KUAM he's heard residents say a possible positive is from his village, but the mayor said he's received no official confirmation from public health officials. For Guam's News Network, Chris Barnett reports.
The movement of COVID-19 patients from the Guam Memorial Hospital to the skilled nursing unit in Barrigada has officially begun. GMH Administrator Lillian Posada says one has already been transferred.
We want to make sure that, their conditions are not so much that their cardiac is going to be compromised. So we're trying to make sure that they really, truly are stable because, the critical period, as Dr. Ogden said, is 6 to 10 days. They could flip over to being really critically ill. So we want to make sure that we continue to monitor them here, and then we're going to transfer. There's a couple that are very, very stable, and so, we'll get them up to SNF.
The SNU is being used as an isolation facility for COVID patients. Currently, 2 out of 3 wings are ready for use. It is a 42-bed facility that provides patients with long-term rehabilitative care. And there's still no definite answer from the Joint Information Center on just how many test kits we have left or what we started with.
So I understand is that, when the box of the test kits arrive, it's not a set number because it's an approximate number. It's approximately you can test as many people. I have to speak to our epidemiologists and our lab guys about what that exact number is. But I was assured that we have enough test kits at this point.
You said enough test kits. What is enough? How do you determine what is enough?
I can tell you we'll make it through the next few days comfortably.
Governor's Press Secretary Crystal Paco San Agustin says, however, more are on their way.
Public Health Director Linda Pinco Tenorsi, she just signed, I believe it was yesterday, a contract with DLS so that we can send more of our test samples off island. We can send them to Hawaii. We can send them to California. So we are exploring all our options. We've also had some of the doctors here, present to us options for purchasing additional test kits.
She adds just recently the CDC allowed Guam to use World Health Organization certified test kits, allowing Guam to purchase test kits elsewhere. Another doctor has stepped forward calling for more transparency about positive COVID-19 cases. In a letter to the governor and public health, Dr. Peter Lombard says, quote, there's a public perception of inadequate communication and that more targeted dissemination of specific information will go a long way to building trust. He asked for the release of data that still protects patient privacy but provides meaningful information to the public. This includes ages of positive cases presenting symptoms, clusters in families, the local areas, villages, and establishments involved, likely source of infection, and the clinics where they were treated. Lombard still seeks similar information from quarantined individuals and airline arrivals. He also asked for more info on current and future testing capabilities, including daily updates. Finally, he asked officials to immediately address rumors, inaccurate data, or leak true information. And no need to hoard or panic buy, there will be plenty to go around. The local shipping industry is reassuring the community that the regular supply chain will continue, unaffected by the coronavirus crisis. Nestor Lecanto reports.
The Chamber's Wholesale, Retail and Transportation Committee met Thursday to discuss current on-island supplies. They got reassurance from the shippers that regular shipments would be maintained, and so the Chamber issued a press release letting consumers know there was no need to panic. Bernie Valencia is Vice President and General Manager for Matson Navigation.
Many of the wholesalers said, in fact, they're actually overstocked because it's hard for them to get some of the product to the stores. And at Matson, I made sure to reiterate that we have a weekly service and it's uninterrupted and the schedule continues.
Part of the reason for the Chamber announcement was to make sure that families who can't afford to buy extra groceries will find that the items they need will still be on the store shelves when their next shopping trip comes around.
I like to talk about being a good neighbor, right? And, on Guam, we always joke about not taking the last one on the plate. So leave some for your neighbors, don't hoard.
And any fears of the goods being contaminated by the virus are unfounded. The containers are packed and sealed by the shipper in accordance with the regulations.
Everything follows the U.S. customs requirements. It's only 14 days from Long Beach to Guam, and everyone's listens and is trying to learn as much as this virus. Obviously, the virus does not live in the cargo or on the cargo. Having sea for 14 days, the cargo is not at risk of spreading any virus.
And Valencia says she didn't check the cargo manifest, but she's pretty sure some of the containers do contain some hand sanitizers and, yes, toilet paper. For Guam's News Network, I'm Nestor Lecanto.
A simple drive through Tumon is proof enough that tourist arrivals are way down. Occupancy rates are plunging fast, and layoffs may be inevitable.
The usually bustling tourist district is a lot more quiet now, and the president of the Hotel and Restaurant Association, Mary Rhodes, says it will soon become quieter still.
Through next week, we're expecting numbers to go a little bit below 30%, and then the week after, I'm hearing arrivals are down to about 20%. Down to zero.
Rhodes made the sobering announcement as a guest on the KUAM News takeover of I-94 containing COVID-19 show. She says some businesses may eventually decide to shut down temporarily, and others are still trying to hold on to employees for as long as they can.
I think that a lot of people are just allowing people to take sick leave and then personal leave first, and that is our recommendation so that we don't have a mass layoff, is exhaust as much of the sick leave and then the personal leave, and then we will get the information out once we hear from Department of Labor.
But as the visitor numbers continue to dwindle, hotels and restaurants will be forced to right-size their workforce.
You can't just let them go and call it, a layoff like that. You have to give certain notifications, and there are time requirements for that, like 60 days, and then you have to offer packages, right, or at least benefits. So we need to ensure that we educate the employers on how to do this if their employees are going to benefit from programs.
Rhodes says she's working with the Labor Department to communicate federal programs that can help displaced workers. For Guam's News Network, I'm Nestor Lecanto.
Labor Oversight Chair Senator Regine Bisco-Lee announced today that Guam will be applying for COVID-19 unemployment benefit grants. She says as much as $100 million will be available nationally through disaster dislocated worker grants. Come to Guam, we are coronavirus free. Hard to believe, but it happened. Sabrina Celis-Montanani reports on the administration's efforts to cash in on COVID.
The governor's office this morning pulling the plug on this Guam Visitors Bureau promo.
We want to personally invite you to visit our beautiful island. Warm weather and warm smiles are waiting for you here.
While there is a global concern for the 2019 novel coronavirus, we want to assure you that we have layers of defense, starting with our airlines and our airport to keep everyone healthy and safe. As of today, we have no confirmed cases of coronavirus on the island.
We are excited for you to explore and experience our island paradise. We look forward to seeing you soon.
Not anymore, as Governor's spokesperson, Press Secretary, and Joint Information Center's Crystal Paco San Augustine says that's been scrapped.
There's this video that is circulating, or actually it's not even circulated, it's up on the World Wide Web. There was a promotion, I understand, it was of the governor and lieutenant governor. Excuse me?
Again, it's being pulled down.
Mhm.
I spoke with GVB this morning. It was an oversight on our part. We didn't pull it down. Again, we expected to pull it down once we had confirmed cases, and that didn't happen. A lot of moving parts, Bree and Chris, and I know you understand it's crazy, and we're adapting every day.
A new GVB promotion launching during a rapidly evolving situation with the coronavirus.
When was this video posted?
This video was posted over a month ago, I want to say.
In
and
February.
That was specific to the markets.
So whose idea was it then that let's promote the fact that Guam is coronavirus free in the middle of a crisis?
That was prior to any of our confirmed cases, Bree.
It was in February when the president declared a public health emergency for the country, and on March 11th when the World Health Organization declared a global pandemic of the COVID-19.
It's being pulled off all our markets.
Reporting for Guam's News Network, I'm Sabrina Salas Matanani.
The Guam Police Department has arrested a total of 10 minors in the past 2 days for violating the curfew law. This week, GPD, along with the Department of Youth Affairs, announced the enforcement of curfew hours that restricts minors from any public place between 10 p.m. until 6 a.m. on weekdays and 12 a.m. until 6 a.m. on weekends. According to GPD spokesperson Sergeant Paul Tapau, the 10 minors were taken into custody and were then released to their parents. Sergeant Tapau says the department will continue to enforce the law for the safety of our community during the spread of COVID-19. Stick around for more news here on Prime Time.
Get up-to-the-minute news, plus access to alerts, streaming radio, promotions, and more on your mobile device by downloading the KUAM News mobile app, available at the App Store now.